Welcome back to New Jersey Viewpoint. I'm Ken Rosato. Now, according to the American Heart Association, twice as many women die from heart disease than all forms of cancer combined. Too often, heart disease is associated with men. Well, here to share the facts and the myths about women and heart disease is Dr. Mary Abed, chair of the Department of Cardiology at Jersey City Medical Center. Thanks for being with us.
Thank you for having me.
Why are so many more women dying of heart disease?
Well, I don't know that there are so many more women dying today than they were in the past, and I think many factors have played into this. Women tend to present later in their illness. They tend to be 10 years older, they tend to be more diabetic, and they tend to present with heart failure. So when they finally present to us, they are a sicker patient population.
So it's not that the rate of heart disease has gone up, it's just that because of the time when you find out that they have heart disease, it's oftentimes too late to do a lot about it.
Well, I think, yes, they come in sicker. Women generally come into the medical community sicker with this heart ailment. I think we're seeing more women because of their risk factors are increasing. You know, in 1984, more women smoked than men for the first time ever. Diabetes and obesity in this country are rampant. I mean, in 1960, 16% of women were considered obese. In 1994, 34% of women were considered obese. It's a huge number. And diabetes goes hand in hand with obesity, and as a result, I think that we are going to see a higher incidence of cardiovascular diseases, not only in women, but in men as well.
I don't mean to stereotype, but all of my female friends tend to be carbophiles, so they're always eating a lot of sugars and carbohydrates, even much more than any of my guy friends do, and I'm wondering how much, just throwing it out there, but how much that has to do with it.
Well, I don't know individually. I think each person's diet depends on what their risk profile is, and today we've learned a tremendous amount about what risks are, and thus what your diet should be. So if it's a young woman who's working out 6 days a week, doing 5 miles each time, and she's clearly thin and has no risk factors, she's lucky. She can eat 70% of her diet carbohydrates.
She's going to burn it off. It's all
she's
good.
going to burn it off. Exactly. Exactly.
Now, so what are some other key risk factors?
High blood pressure, and in this country, almost 60% of women over the age of 30 are hypertensive. Hyperlipidemia, or high cholesterol, high triglycerides, a significant risk factor in the general population. Smoking. Smoking is a real big risk factor. To me, I always use this statement, it's like gasoline on the fire. And 21 million women in this country smoke still today, despite everything we know about it.
I remember my dentist saying once to me that if you show me somebody in their 50s, 60s, 70s with dentures, and I'll show you somebody who smoked. So if it just does that to your teeth, I can only imagine what kind of vascular disease you form. How important then is it to have the cholesterol monitored on a regular basis?
It's pretty important. And again, today what we've done is we've categorized people by their risk profile. So if you are a high-risk patient, that cholesterol level has to not only be monitored but brought down way low so that the good and the bad cholesterols are where they're recommended to be. And I would say, you know, if you are at risk, meaning that you have at least one risk factor, that you are followed on a yearly basis. And no risk factor, you know, it's as you get older, these numbers increase. Clearly in women, high cholesterol and high blood pressure exponentially rise in the 5th and 6th decade of life, such that by the time we are 60 and 70, there are more women who are hypertensive and hyperlipidemic than men.
No kidding. And what is the importance now of aspirin, the role of aspirin? A lot of people want to just start taking it, but you can't because it could also cause bleeding, so you got to be really careful. Talk to your doctor about that.
That's a great question to bring up today, because up until recently, when we started what was called the Women's Health Initiative, which enrolled 100,000 women and observed them, it's called an observational study, we simply extrapolated the information we learned about men to women. So with men, clearly there have been multiple studies that showed primary prevention, that is, to prevent the first cardiac event, aspirin was beneficial. But in women, we've learned that's not the case. So really, the recommendations for prevention of cardiac disease in women today is that under the age of 65, unless you are a high-risk woman, you probably need not take aspirin for that reason, because the risks of bleeding may in fact outweigh the benefits of the pill.
We have about a minute left. If, heaven forbid, someone thinks they're having a heart attack, what do they do?
Well, I think that they call, if they are a high-risk person, I think that they should call 911 or get to a physician or a hospital as soon as possible, because ruling it out is no risk to your life. But if you sit home and wait, you know, time is heart muscle. And the quicker we can diagnose it and treat it, the far better the patient does.
And if you're on the road trying to get to a hospital, what's the old rule about coughing severely? Or
well, you know, that's an interesting thing. That, in fact, could possibly prevent sudden cardiac death in that it may prevent the onset of a lethal arrhythmia.
Okay, well, thank you very much.
You're very welcome.
Nice to meet you, Doctor.
Thank
Definitely
you.
a pleasure. I'm Ken Rosado. We want to thank you again for joining us. Enjoy the rest of your weekend.